Hello, world. Today is Wednesday, August 12th. This is the Sideshow. I'm Theodore Parker, coming to you from the East Coast of the United States, Florida. Actually, it's Lexington, Kentucky. And today, in this area, currently with the weather, we're having rain. And flash flood warnings, flash flood watch, and also thunderstorms currently going on, which is why I thought, according to the weather report, things would be concluded by now, but they are still going on. So, this is the Sideshow. I'm Theodore Parker. Again, hello, world. Looking at the weather for today in this area, it's raining. Currently it is 66 degrees. Temperature will go up to 89. We have a flood watch until Thursday, 8 a.m. Eastern Daylight Time. And a flood advisory from Wednesday, 7:16 a.m. Eastern Daylight Time until Wednesday, 10:15 a.m. Eastern Daylight Time. Also, flash flood warning until Wednesday, 10:45 a.m. Eastern Daylight Time. So again, scattered thunderstorms, highs in the upper 80s and lows in the upper 60s. Expect tomorrow to be next no precipitation day. Temperatures a little lower than yesterday, down by 4 degrees. And today, currently, conditions for outdoor activities: running is poor, cycling is poor, and gardening is poor. The AQI, Air Quality Index, is good at 31. Pollen, tree, none. Grass is low, and ragweed, none. The UV index is low right now, and it feels muggy with a light breeze at 6 miles per hour. Today's sunrise was at 6:50 a.m. and sunset will be at 8:34 p.m. And currently the time here on the East Coast, 9:35 a.m. So that's our weather report for today, this morning. Rain expected again Friday, again Sunday, and then the first of the week, more rain. I spent the last couple of programs kind of going around in other places in the world. Spent some time in Africa talking about that, and Europe and other places outside the borders of the United States. But today, we're going to come back inside the borders of the United States of America and cover a few things. I had seen on the internet, this woman had been addressing a few common phrases or sayings that we have amongst ourselves. One of which is, and I have used it myself, put your 2 cents in for what it's worth. So she took it a step further. She said, well, if you put your 2 cents in and it's a penny for your thoughts, who gets the extra penny? So I thought that was pretty cute. But anyway, getting down to where we are now. On Monday, President Trump signed a executive order that would change the way vaccines are handled for children. So that vaccine had to do with preschool vaccinations, particularly mumps, measles, and rubella, which he said would be given separately. And I kind of thought I would start out with that because here in this area, this is the first day of school. You know, parents are always concerned about what affects them and their children, and especially in regards to their health care. So this response comes from Chrome, I just asked the question, the executive order that Trump signed, how does it affect everybody? So this was the response that I received. A question: how does President Trump's executive order to reduce the number of childhood vaccines actually affect children? The prescribed number is 18. He signed an executive order to reduce it to 11. So here we go. President Trump's executive order on childhood vaccines aims to reduce universally recommended pediatric immunizations from 18 to 11 diseases and split combination shots like the MMR vaccine. In the short term, it does not change actual vaccine availability, school mandates, or insurance coverage, but it creates confusion and logistically pressures families to make more doctor's visits. And at this point, I'm going to chime in with my own trip down memory lane. If you recall, President Trump also withdrew the United States from the World Health Organization, which I thought was not the best move, because the World Health Organization serves us universally, especially when it comes to outbreaks, and saves time on research, because there's a pooled data situation where you don't have to repeat the same ground over and over again, but everybody strives for a solution that mutually serves. So, continuing with this response: immediate and practical impacts on families. No instant change to shots or insurance. Major private insurers and public programs like Vaccines for Children continue to cover standard pediatric immunizations as recommended by traditional medical guidelines while the order is reviewed. Logistical barriers. Spreading immunizations across separate visits turns single appointments into multiple trips. Pediatricians warn this extra travel and time requirement will cause some parents to delay or completely miss vital shots for their kids. Unavailability of separate doses. The order calls for splitting the combined measles, mumps, and rubella, MMR, shot into individual injections, but standalone single disease versions have not been manufactured or sold in the U.S. for many years. So that puts that one in. The response continues: public health and policy consequences, state-level conflicts. School vaccine requirements are determined by individual states rather than Washington. The order directs the Justice Department to challenge state laws enforcing vaccine mandates or restricting exemptions, creating a prolonged legal battle. Undermining medical consensus. Major medical organizations, including the American Academy of Pediatrics, emphasize that extensive global research shows no link between vaccines and autism. Health experts caution, which was Trump's reason for signing this executive order, that he thought that these vaccines were connected to autism, in case you missed that. Health experts caution that official skepticism from the administration risks lowering vaccine rates and triggering preventable disease outbreaks. And then from August 11th, Children's Health, NPR, National Public Radio. 5 questions parents may have after Trump's latest vaccine move. So, here we go. As far as pediatrician Dr. Jennifer Shue in Atlanta says, parents in her practice aren't asking her about what the executive order means for their kids. At the very beginning, when the administration started making changes, people were concerned about, gosh, are we no longer going to have access to certain vaccines? She says, but I'm not hearing that anymore. So the potential for confusion is real, she says. Here are the answers to 5 questions parents might be having about the executive order. Are the same shots still available? Yes, as of right now, yes, she says. All of the shots and childhood vaccines scheduled back by pediatricians are still available. Next question, does this affect which vaccine? The response is longer than what I'm sharing with you, but if you want to access the article, you may do so. Number 2, does this affect which vaccines are covered by insurance? First paragraph responds, no health insurance coverage is unchanged for all vaccines in the American Academy of Pediatrics vaccine schedule. Nearly all families can receive vaccinations with no copays, including families without health insurance. Third question, why is this vaccine order happening now? First paragraph responds, it is not entirely clear why this executive order is being rolled out now, especially so close to the November midterms elections, since some Republican pollsters have warned vaccine changes are politically hazardous. The timing also intersects with the beginning of the school year. So the next question, the response kind of gives Trump's comments connecting it to autism, and the doctor's response, Dr. Xu responds, there's nothing new, nothing has changed with the science. She adds the effort to change the vaccine schedule is based on misinformation. Question number 4, what's the idea behind spacing out children's shots? Her response in the last paragraph, spacing the vaccines out has downsides, she adds. Splitting them up leaves a kid more vulnerable to certain infections if they get exposed before they're fully protected by the vaccine. It means more visits to the doctor's office. It means more time off that the parents take, things like that. And question number 5, could the MMR shot be split into 3 shots? First paragraph responds, maybe, but it would take a while. The executive order calls for the measles, mumps, and rubella vaccine to be divided into 3 separate shots. But right now, separate shots for those vaccines are not available in the U.S. A White House official told reporters on Background Monday that the administration would be working with private drug makers to explore making those available. And her response in the last paragraph, as we can see with the measles outbreak, as soon as you start to bring vaccine coverage down, even a slight amount, that is where you start to see breakthrough infections. That's the risk here. So those are the 5 questions. Responds Children's Health, Dr. Jennifer Xu, NPR. So I thought that would make that first up, back to school, executive order, parents put in a position that they see a little cloudiness to what's going on. And his decision does not support the facts. Since we're in the borders of the United States again, recently Toyota had a 655,000 car vehicle recall for faulty turn signal. In case you're an owner of that one, you might want to check that out as well. Moving along, globally, universally, we have several things in common. Most significantly, what comes to my mind is food, shelter, and clothing. So on that, on that note, we have food. So recently we've been going to the Cyclosporia outbreak. and which was traced back specifically to shredded lettuce from Taylor Farms to Taco Bell. Since then, some other information has come forward, and what occurred to me was this food outbreak, food contamination, food recall seems to be kind of intense right now. So let's do this one thing at a time. First of all, from June 17, 2026, this responds to that question. Since the cyclospora outbreak, how many food items have been recalled? So here we go. The multi-state cyclospora outbreak linked to iceberg lettuce involved a broad recall initiated by Taylor Farms on July 17, 2026. This recall covered all iceberg lettuce sourced from central Mexico, encompassing roughly 35 total affected products distributed primarily to food service providers, alongside a small number of retail items sold at Walmart. Recall details in scope: producer Taylor Farms de Mexico, primary source iceberg lettuce sourced from central Mexico. Total affected products: 35 specific commercial and retail product variations. The vast majority shipped to food service operations like restaurants, with a few retail packages such as market-side salads and shredded lettuce at Walmart. Impact: linked to thousands of reported cyclosporiasis cases across 15 states. It continues. From Google to Chrome. Had to kind of cross-reference some of this. Get my ducks in a row here. Okay, this one is a little more extensive, and this is coming from USA Today. And like I said, this seems a little bit intense with the food recalls and things of this nature, but this is running from July of this year back to February of this year. And this is, like I said, is coming from USA Today, and it's dated July 20th. So we're almost already past that by a month. But what struck my interest about this particular article was it gave a composite list. If I can just get up on here a little bit. Okay. It's cooperating, but not cooperating the way I initially saw it. Okay, this is from Taylor's Farms. Might have to go back. Taylor Farms. It was a list, like I said, running from February to currently July. Okay, excuse me, folks. This is what happens when you get excited. This particular response had a whole list of things from baby food to infant formula to erectile dysfunction medications, even to items that we continue to use. And especially it struck me about over-the-counter medications. I may have to summarize this or keep talking while I'm looking. That when we go to the doctor, which is why I say, make a doctor's appointment, keep a doctor's appointment, because medicine is constantly researching things, and maybe some of the medications that we're taking are no longer being used, or there's a better medication for that situation, whatever the case may be. But by the same token, doctors are able to correlate our medications so that they don't go against each other. And buying medications online, such as, Viagra or Cialis, sometimes causes a lower heart rate. Could also slow our breathing down to the point where we could, pass out or suffer some other kind of side effect. So that's something to kind of keep in mind in dealing with things over the counter. And then also they can tell from your blood work or blood panel which medications need to be changed, which ones have done what they were supposed to do. So this requires a certain amount of updating. And also, how we are treated also has to do with being with age related. So what doctors are looking for when you are in your 30s is not the same as in your 40s, not the same as in your 50s, not the same as in your 60s. And as you retire, it also changes. So it pays to have a professional medical opinion of what's going on and how these things affect us. And then also in that list of things, there was, surprisingly enough, a medication to increase women's sexual desire, which I was not aware of. Once you get past baby food and lettuce and deli meats and all the other type of things that have been affected. So that's another thing that probably would be prescribed by a registered physician. So all these things coming out of this cyclosporia outbreak, including the 15 states that have been affected, some in the South and then across, have just kind of put this country in a tailspin about what we are doing at the grocery store and how we are handling our products. And I was really interested in sharing that information because it went through so many products and how we even handle the way we pick up groceries and put them in the cart and the order of things, the meats that we handle and washing our hands and how we store them, and from produce to frozen items. So it was really interesting. If I can find it again, I will be the first one to bring it back up and let you know about it. Keeps bringing me back. It was a sub. So that's what I wanted to bring to you about cyclosporia and lettuce and more. And those recalls were dated from July or August now to February 2026, and it's quite a list. And my notes say Chrome history, but folks, it's just not cooperating right now. It could be just me. Sometimes these things go like that, but I'll take it for what I can get. The next thing, Netflix. right now, Netflix is running some documentaries on food items, surprisingly enough. And this particular one that caught my interest, which I did take time to watch. And before I even get into this, I'm going to say this way. Research has shown over the past several years that obesity numbers have risen higher than the numbers in regards to children, than the numbers related to children starving. Obesity numbers are higher with children than the numbers related to children starving. So this particular, it's a documentary. It's called Big Chicken, a Fast Food Conspiracy. And the little thumbnail reads, ultra delicious, ultra convenient, ultra processed. This documentary digs into how fried chicken has taken over the world and what it's costing us. So it's presented by a comedian, Mo Gilligan, from London, England. And because he's a comedian, there's a sense of humor about it, but I'll kind of give you a little preview, to kind of whet your mental appetite for it. He does 28 days of nothing but chicken, breakfast, lunch, and dinner. And he travels around England first, then comes to the United States, goes around the United States in regards to fast food chicken, then goes back to England to conclude his story. But before he starts, which is something that was unexpected to me, although it's recommended whenever you start anything, to consult with the doctor, which is what he did. So he got, he got a clean bill of health from his doctor, but he asked her, well, would you do it 28 days of nothing but chicken? She said, no, I would not do it. And even his group of friends and how he financed all this is beyond me, because I know several years ago when I was planning on going on a cruise, they gave me like 18 months to pay off everything before I even went on the cruise. So if it takes that long to go on a cruise from Kentucky to Florida, get on the boat, spend some time, come back, and it takes a year and a half, I imagine traveling around the world for all intents and purposes would be a little more intense. But anyway, one of his friends says, well, he's a comedian, so he has a tendency to laugh, about things, and I'm not sure how all this is going to affect him. But folks, it is well worth watching. Big Chicken, a Fast Food Conspiracy. At the same time, you have included in the same series, Korean Fried Chicken Rhapsody, You Are What You Eat. I'm not sure how to say this word, but Garnachas, Glorious Street Food is another one. And Tacos Chronicles is another one. And Buy Now, the shopping conspiracy. So between all of those, what I would suggest is start with Big Chicken, a Fast Food Conspiracy, and whatever else strikes your interest after that, I'm quite sure it'll be an eye-opener. So, now that we're back in the borders of the United States, with everything that's risen to the top over the past couple of weeks while we were traveling around the world, seeing how other countries were doing, this is America, folks. Today is Wednesday, August 12th, 2026. This is a sideshow. I'm Theodore Parker. That's it. Hashtag